In today's medical moment, most of us are familiar with certain types of cancers, like breast cancer or melanoma, but they're much less familiar with uterine cancer and who it affects. Well, Dr. May Zakur, she's a oncologist. I saw a gynecological oncologist from Spectrum Health. There's a mouthful. She's here to help us better understand uterine cancer, its symptoms, and who might be at greatest risk. Good morning, doctor. How are you?
Good morning. Thank you for having me.
Absolutely our pleasure. Let's start with a definition. What is uterine cancer? And really, how prevalent is it in the United States?
So uterine cancer is actually pretty common. There are two major types of uterine cancer that we think about. One is the much more common endometrial cancer, which affects the inner lining of the uterus. But we also rarely will see uterine cancers that actually arise in the wall of the uterus. More commonly, they're called sarcomas. But by far, endometrial cancer is more common. About 66,000 women per year in the United States will be diagnosed with endometrial cancer, and it is the fourth most common cancer in women that we see diagnosed every year.
Oh my goodness, so it is in the top 5 for women out there, and you said, what 5,000 plus cases a month being diagnosed. So who is at risk of developing uterine cancer?
So when we think about risk factors for endometrial cancer, there's kind of 3 major categories. So age being the number one risk factor. So as women get older, as we hit those postmenopausal years, we see endometrial cancer much more commonly. The second risk factor is anything that increases the circulating estrogen levels in women's bodies. So the most common of which is obesity. So women who are overweight or obese are at higher risk of endometrial cancer, and women who are taking certain medications like hormone replacement therapy or tamoxifen, which is a medication for breast cancer, those also increase the risk of endometrial cancer. And lastly, the third major risk factor is hereditary predisposition to uterine cancer. So there's women who have something called Lynch syndrome or other hereditary conditions that put them at increased risk.
You mentioned that last point there, family members, hereditary, a genetic aspect to this disease. Is there a racial disparity in death rates with this disease?
Absolutely. So there's likely several factors that go into that, but we know that Black women are dying at higher rates from endometrial cancer, and that seems to actually be going up over time. We know that Black women are more likely to have some of the higher risk aggressive types of endometrial cancer, and that these may be diagnosed later, and that some of the workup tools that we have, like pelvic ultrasound, are not as good at diagnosing some of these high-risk endometrial cancers. And so we know that the death rates are much different between Black and non-Black women. This is something that needs to be addressed on several levels.
Absolutely. And Dr. Zakur, when we think about the signs of cancer, you might think of a mammogram for breast cancer, or feeling a lump, something that you probably can't do with your uterus. So what are the signs and the symptoms of uterine cancer?
So the most common thing is abnormal bleeding. In premenopausal women, that looks like bleeding between periods or heavier bleeding than women are used to having. In women who are postmenopausal, any bleeding is considered abnormal. So even a tiny amount of spotting that some women will sometimes write off, that's very important to discuss with their provider. So any bleeding after menopause. And then occasionally we'll have women who will present with pain, pressure on the bladder, discharge, but bleeding is the most common symptom.
Well, if someone watching right now is concerned, maybe seeing that list of symptoms, thinks, well, that's me, what's the best step? What's that first step she can take?
So that woman needs to talk to her provider. Ideally, they would be seen by a women's health provider, like a gynecologist, who can help with the workup for that. If a woman does not have a gynecologist, she can see her primary care provider and needs to mention those symptoms and request a referral to a women's health provider.
All right, so get to talk to your doctor if that's you. And how do you treat this? What are the treatments for uterine cancer?
So it really depends on the stage at which it's diagnosed. Most commonly, these are diagnosed at an early stage where they can be treated with surgery like a hysterectomy. But there are other treatment options for more advanced stage endometrial cancer. We sometimes are looking at chemotherapy and radiation. For early stage endometrial cancer in women who desire to preserve fertility, so in these younger women who are diagnosed, sometimes we use hormonal therapy. So the treatment strategy really depends on the woman's age, the stage of diagnosis, and what her preferences are. But there are treatment modalities that we have, and we will individualize it for each patient.
Excellent. Dr. Zakur, if someone's watching this right now and maybe they missed some of that information you were giving us, or maybe they want to take a deeper dive, I'm sure more information is, what, a mouse click or a phone call away?
Yeah, so we have information on our Spectrum Health website, so www.spectrumhealth.org /services/cancer, and you can find more information on uterine cancer there.
Perfect. Dr. Zakour, thank you so much for the information and your time this morning.
Thank you.
Absolutely.
Good morning.
Yeah, you as well. For more information, as you heard, just head to spectrumhealth.org /services/cancer or call that toll-free number on your screen, 855-SH-CANCER.